Good morning. I'm Dr. Ben Aryeh from Israel. Today we will talk about acupuncture research in the ICU. I have been studying this topic for the last 8 years. Let's begin. A brief introduction to acupuncture research in the ICU. My name is Eyal Ben Aryeh, Banlu, as I said. I'm from Israel, Israel, 36 years old. Acupuncture and Chinese medicine practitioner in Israel. I did my master degree and my PhD in China Medical University and a postdoctoral fellowship also in CMU until today. Outline. For today's presentation, we'll talk about is acupuncture safe in the ICU, poor digestion in the ICU, ICU delirium, and mechanical ventilation support. Is acupuncture safe in the ICU? Okay, so we have published this study, is acupuncture safe in the ICU, a systematic review and meta-analysis in Frontier in Medicine. We want to check the safety of acupuncture, so we included all possible published papers about acupuncture in the ICU, 31 studies, 2,947 patients in total. Out of them, 1,251 received acupuncture. There were no serious adverse events in any of the included studies. 10 patients in the acupuncture group had minor adverse events. The minor adverse events following acupuncture include needling, insertion pain, agitation and nausea, diarrhea, hypotension, and abdominal distension. In the meta-analysis, the minor adverse events, there was no significant difference between acupuncture and the control. So it means that acupuncture is safe. Okay, we did find some positive effect of acupuncture. One is a significant reduction in ICU length of stay following acupuncture treatment, with a reduction of 1.45 days mean difference, okay? And a significant reduction in 28 days mortality as well, with an odd ratio of 0.61. So this is the ICU stay. We can see the significant p-value and the reduction in 1.4 days and 28 days mortality reduction as well. How can acupuncture help for ICU patients? So there are situations that Western medicine might be limited, and such as poor digestion, ICU delirium, prolonged mechanical ventilation. For poor digestion, according to Rentam et al., 59% of ICU patients had at least one gastrointestinal GI symptom, okay? And the prevalence of the GI symptom at the first day in the ICU predict ICU mortality. It also relates to bowel sound. So patient with normal bowel sound will have 11% mortality. Patient with abnormal bowel sounds will have 22% ICU mortality. And patient with no bowel sound will have 36% ICU mortality. And also with ICU length of stay, patient with 0 GI symptoms at admission will have 3 days in the ICU. Patient with 3 GI symptoms at admission will have 11 days in the ICU. And patient with 5 or 6 GI symptoms at admission to the ICU will have more than 30 days in the ICU. It's partially also affected by a type of nutrition, like enteral nutrition and parenteral nutrition. Okay, we have conducted this study, digestion-specific acupuncture effect on feeding intolerance in critically ill postoperative oral and hypopharyngeal cancer patients, a single-blind randomized controlled trial. The study mainly include oral cancer patients at the postoperative stage. Right after the surgery, they are still in the fasting stage. Okay, so we can measure the digestion. We have 13 patients in the intervention group and 13 patients in the control. In the intervention group, they receive acupoint for digestion, like the points in the picture. The current research and ancient Chinese medicine texts indicate those points for digestion. And for control, we choose points that are not indicated for digestion. We found that the patient in the intervention group reached the target energy expenditure of 70%, 80%, and 100%, much quicker than the control. For 70%, after 3 days versus around 5 days in the control, and for 100% after 4.5 days versus 7 days in the control, according to the simplistic weight-based equation. And for total calorie intake in the first week, we have also a significant increase in the intervention group for calorie intake. So the treatment group or intervention group reduce feeding intolerance. Topic number 2, number 3 is ICU delirium. ICU delirium can affect 25 to 80% of ICU patients. We know it can have some long-term implication, higher mortality and higher ICU costs. And we know that it can be divided into hypoactive, hyperactive, and mixed stage. Those are the risk factors. I'm sure you're familiar with them. Okay, so this study from Japan, published in 2017, acupuncture and traditional herbal medicine therapy prevent delirium in patients with cardiovascular disease in intensive care unit. So they have 30 patients in the acupuncture and herbal medicine group and 29 in the routine ICU care. This is a non-randomized trial. It's a retrospective trial. And they found that significantly lower patients develop delirium. So we have only 2 patients develop delirium in the treatment group versus 11 in the control. So acupuncture and herbal medicine had some protective effect against delirium. And the last topic we can talk is, we have time to talk today, is mechanical ventilation. Okay, we have published this study, acupuncture reduces mechanical ventilation time in critically ill patients, a systematic review and meta-analysis of randomized controlled trials. Was published in the journal Explore in November 2023. We included 10 studies, 10 clinical trials comparing acupuncture to routine ICU intervention. We find a significant reduction in mechanical ventilation days with a mean difference of 2.06 days less in the ICU. Significant p-value you can see here, and mean difference. So the patient after acupuncture will need 2 less days under mechanical ventilation. And we find also a significant reduction in ICU length of stay following acupuncture, and also reduction in total mortality. You can see the ICU length of stay. We have significant p-value and a mean difference of minus 1.26 days. And for total mortality, significant p-value, and we have a risk ratio of 0.67. However, in this meta-analysis, there is small sample size effect, existing heterogeneity that should be taken into consideration. In conclusion about today's presentation, we see that acupuncture may improve ICU patient overall outcome, like reducing feeding intolerance, delirium, mechanical ventilation time, ICU length of stay, and mortality. And I think that Taiwan has the opportunity to lead the world in cooperation between acupuncture, Chinese medicine, and the ICU. Okay, those are the references for today's presentation. Thank you very much. I want to thank Professor Li Chen, and that he will present today, and also Dr. Gao from the surgical ICU in China Medical University Hospital. Thank you very much.